The Health Secretary saying he wants pupils back after Easter. Public Health England saying overnight that primary schools are already safe to reopen. So which is it? What is the plan for full reopening? The Schools Minister mentioned some metrics, but was vague about the required performance against them. Can he give us some more clarity? Will schools only return if R is below 1? We've read reports that Public Health England believe primary schools are safe to open. Are these reports accurate, and will he publish the scientific evidence? Will there be a credible testing plan in place as pupils return? How will the government get this chaotic system back on track? Can he tell us in what order pupils will return to the classroom? Will it be exam years first, primary schools first, or a regional variation? And what's the plan for the return of college and university students? Why has the government repeatedly ruled out the use of rotas to keep pupils in the classroom as a means of reducing transmission? What will be done to help pupils catch up on the learning they've lost? And can the Minister guarantee that schools will be first to reopen when it's safe to do so, or will other restrictions be lifted before children return to the classroom? Parents and staff need support, Mr Deputy Speaker, and they need to be able to plan. They need answers to these questions, and they need them now.
Well, the honourable member asks for a plan. There is a plan, Mr Deputy Speaker. Schools were closed as part of the national lockdown, a lockdown introduced to tackle the growing pressure on the NHS. And there are clear criteria for emerging from the lockdown, including hospitalisation rates and the other 3 criteria I mentioned in my opening comments. We've always been clear that schools will be the last to close and the first to open as we emerge from the national lockdown with when the criteria says it is safe to begin to do so. Now, she's asked about the safety of schools. Well, we've always been clear that these restricted attendances in schools is not because schools are unsafe, but it's in order to reduce the overall number of social contacts in our community. She asked about testing. Lateral flow device testing is taking place in our schools. We're testing staff twice a week to identify asymptomatic COVID cases. And for those pupils returning to secondary school or being in secondary school at the moment, they will be tested twice as they return to school. And she said again, why aren't schools the first to open and the last to close? Well, that is something we've been making clear all along. And I had to say to the Honourable Lady that the problem with her is that she's repeatedly calls for action that we're already taking. She's always 2 steps behind, and the opposition really has no plans, no direction, and no clarity on what is the biggest crisis facing this country and the world for nearly a century.
Video link. Chair of the Education Select Committee, Robert Halfon.
Thank you, Mr Deputy Speaker, and I thank all teachers and support staff for all their work that they are doing to try and teach children at this time. My right honourable friend will be aware of what a number of paediatricians who've written to the Times today talking about children's anxiety, depression and self-harm all at frightening levels because of school closures, that parents are showing signs of psychological stress and breakdown as a result of the pressures of trying to homeschool their children, sustain their jobs and businesses. We just need to get our schools open again sooner rather than later. So could I ask him, why not open schools and colleges in the areas where COVID cases and the R is significantly lower? Will he put mental health practitioners in all schools to help children and parents during this time? And finally, what discussions has he had with the JCVI on priority vaccinations for teachers and support staff so we can help put an end to this revolving door of learning that's characterised education this year? We just need to get our children back in school full time as soon as possible.
Minister.
Well, my right honourable friend is right to pay tribute to teaching staff in our schools, and he's right to point to the very difficult circumstances that both parents and students face when they are having to learn from home and they're not with their friends. And we all know that being in school is the best thing for young people rather than learning from home. All the decisions, Mr. Deputy Speaker, that we are taking are with the well-being of students at the forefront. We understand the disruption, the panic, the pandemic is causing to students' education and the impact that this may have had on their mental health. And we remain committed to introducing the new mental health support teams for schools and colleges, and also to support the return to school. We have put in place a range of measures and guidance and a new £8 million training initiative for school staff to support children's well-being. And the health elements of the new RSHE curriculum includes teaching about mental health and well-being. And of course, the NHS continues to run 24-hour helplines for those for those people that have mental health problems. He asked about regional differences in infection rates. We will always be led by the science when making decisions about moving away from the lockdown conditions. And he finally asked about vaccines. Well, the JCVI advises that the first priorities for the COVID vaccination programme should be the prevention of mortality. And with regard to the next phase of the rollout, the JCVI have asked the Department of Health to consider occupational vaccination in collaboration with other departments, including the Department for Education.
A 1 minute limit. Video link. Carol Moynihan.
Thank you, Mr. Deputy Speaker. And we're all acutely aware of the impact of school closures on our children, none more so than those of us that actually have children and are trying to juggle work and homeschooling. But can he assure the House that schools will only reopen when the scientific evidence indicates it's safe to do so, and not because of pressure from the backbenches? I would hope that the Minister has a set of key targets that must be met before reopening. Could he share these with the House today? Is there a maximum R value that the government is looking at before reopening? And I would just echo the calls from the Chair of the Education Select Committee that JCVI looks at the prioritisation of teachers for vaccination. Thank you.
Well, can I just say to the honourable lady, as I said to the honourable lady opposite, that we have not restricted attendance because schools are unsafe, but in order to reduce the overall number of social contacts in our community. Both PHE and the Department of Health and Social Care confirm that the system of controls that we have in our schools, the extra hand washing, the hygiene, the ventilation, the one-way systems, the masks in communal areas and so on, create an inherently safer environment for children and staff where the risk of transmission of infection is substantially reduced. This is about reducing transmission in the community, and it is one of the measures after Tier 4 that we introduced to do that. She asked about the criteria for emerging from the lockdown. As I said at the beginning of this UQ, those criteria about emerging from lockdown include issues such as hospitalisation rates, mortality, the rate of vaccination, and the challenge of the new variants. But we will be led, and I can assure the honourable lady that we will be led by the advice of SAGE, the Joint Biosecurity Centre, Public Health England, and the Chief Medical Officer in any decision that we take regarding the reopening of schools.
Siobhan Bailey.
Thank you, Mr. Deputy Speaker. And I think to the previous point, I hope the backbenches get louder on this point because it is more important than ever. And we need to hear about my Stroud dad who contacted me because he is so desperately worried about the mental health of his children being at home all day. And the parents that are contacting me on Instagram. Instagram is for pictures of cats, and they are absolutely at their wits' end about juggling childcare and work as well. Will my right honourable friend reassure Stroud's parents that the reopening of schools is being treated as a national emergency? And taking his point about evidence, will he work with the 6 Gloucestershire MPs to see if our falling COVID case rates and the low transmission in schools mean that our primaries can reopen after half-term?
My right honourable friend is right, and we do take the mental health of pupils and parents, and indeed school staff, very seriously in all the decisions that we are taking. Indeed, my honourable friend on the front bench is convening a mental health action group to look at the effects on children and young people and staff in the education system, and we'll confirm the next steps about that as soon as we can. But at every step, we will be led by the scientific advice about when it is safe to reopen schools.
Video link. Dame Diana Johnson.
Thank you, Mr Deputy Speaker. And following on from the Chair of the Education Committee's question, the Children's Commissioner, who leaves her post shortly, is a terrific advocate for young people and has highlighted the effect of school closures on children's mental health and well-being for many months. And families in Hull North are struggling. And as a nation, we are storing up a time bomb of mental health issues for a generation. So I'd like to know, what discussions has the Minister had with the Secretary of State for Health about real and additional support to schools, to CAMS, and to the voluntary sector groups helping children and families now?
Well, she will be aware of all the work that the Department for Education, Ministers, Secretary of State have done in recent months, and indeed more than that, over a year ago, on the mental health, the children and young people's mental health green paper, to ensure that we roll out over the next few years a very serious series of support for mental health provision in our schools. It's a huge program, and it's designed to help children with serious mental health issues. It's also designed to alert and to take action when there are early signs of mental health conditions in children. It's a huge project, one we are continuing with. And during the pandemic, of course, we have put a range of measures in place to help tackle the mental health concerns that the pandemic is throwing up, including, as I've said, the action group set up by my honourable friend, and the £8 million training initiative for school staff to support children's well-being that is already up and running.
Video link. Felicity Buchan.
Thank you. Thank you, Mr Deputy Speaker. The majority of parents in Kensington would like to see their children return to school after the half-term break, especially with proper testing in place. The Prime Minister assured me in early January that there was a cautious presumption for children to return at that time. Since early January, rates in London have fallen significantly. Can my honourable friend assure me that everything is being done to get children back into school, and that we have not ruled out a return after the midterm break?
Well, as a schools minister, no one in this House, not even my right honourable friend, the member for Harlow, or indeed my honourable friend, is keener to see all schools back and open to all children and young people. But we will be led by the scientific advice when we make that decision, and that will be how we best tackle the transmission of this virus in our communities.
Video link. Commissioner Ali.
Thank you, Mr Deputy Speaker. Parents and children have faced unprecedented pressures, in part thanks to the incompetence of this government. We've had the failures with test and trace, we've had indecision about school closure and now schools opening, and we've also had huge issues with the distribution of laptops. In Tower Hamlets, we have 60% of children facing poverty, the highest in the country, and a shortage of 10,000 laptops. Can the Minister update the House on when my constituents can get the laptops so that they can get the education that they need urgently while we are in lockdown? The government's had nearly a year now, and we've got children whose life chances are going to be damaged further if this isn't sorted out immediately.
Well, she failed to mention, of course, the fact that this government has purchased hundreds of millions of doses of vaccine from a range of different providers, that we were one of the first countries to begin rolling out the vaccine process. She failed to point out that we have already purchased 1.3 million laptops for disadvantaged children in our schools who may not have a device, on top of the 2.9 million laptops and tablets that already exist in our schools. And so far, we have delivered to the hands of children and local authorities and schools 876,000 laptops purchased in a demanding global market, built from scratch, imported and distributed. It is an amazing logistical exercise. It would have been nice if the honourable member could have paid tribute to the work of hundreds of staff in Computer Centre and in the Department for Education for such an amazing achievement.
Video link. Lawrence Robertson.
Thank you, Mr Deputy Speaker. I'm sure the Minister would join me in paying tribute to the two special schools in my constituency, Alderman Knight and Milestones, as they carry out such amazing work with pupils who are very challenged. These pupils are less aware of social distancing requirements, and the school staff need to work in close proximity to those pupils, coming into frequent physical contact with them because, for example, of the disabilities which some of the pupils may have. So does the Minister agree with me that vaccinating teachers and staff at all schools would bring great benefits, and particularly so at special schools?
Well, my honourable friend, of course, makes a very good point. I pay tribute to all the staff who work in our special schools. They remain open for vulnerable children, and they do a wonderful job. And for children with SEND, attending attending their educational setting is crucial, so that they can receive, high quality teaching and the specialist professional support that they need. And my honourable friend makes an important point about vaccines. The priority for the first phase is on mortality, but in the second phase, the JVCI will be looking at different occupations, and the Department for Education will be pressing the case for the education workforce.
Video link, Daisy Cooper.
Thank you, Mr. Deputy Speaker. For months, parents, teachers, unions, MPs and local authorities have been calling for rotas in schools, for school transport that is ring-fenced to a single school to reduce transmission, for laptops and internet access for children, for vaccinations for teachers, mental health funding for young people, and the myriad of extra COVID costs facing schools, for directly employing supply teachers for one-to-one catch-ups, and trusting local public health directors and schools to decide how best to reopen. So, Mr. Deputy Speaker, the ideas are there on how to reopen schools safely. So why is there still no plan?
I set out at the beginning, there's a very clear plan for reopening schools. It's based on the fact that schools are part of the national lockdown, and there are clear criteria for how and when we emerge from that national lockdown. It will depend on vaccinations, it will depend on mortality, it will depend on tackling new variants, and most importantly of all, it will depend on the pressure that the NHS is facing. And all those other issues that the honourable member trotted out, we have been working on them. We have, in May, we entered into a contract to purchase 200,000 laptops. We increased that in August, we increased that in September, we increased it in October, we increased it in November. These computers are built to order. There is a long lead time, but we anticipated and prepared for every contingency, which is why we have orders in place for 1.3 million devices, of which 876,000 are now in the hands of young people and schools. She raised the issue of rotas. Well, the rotas are difficult for secondary schools to implement at the same time as providing full-time education for vulnerable children and critical workers. Rotas don't prioritise exam years, and we only ever restrict education as a last resort where transmission is exceptionally high, and rotas are a less effective means of reducing transmission risk than the approach set out in great detail in the contingency framework.
Video link, Paul Bristow.
Thank you, Mr. Deputy Speaker. Yesterday, I took part in a mental health summit with Peterborough citizens, our local CCG, and many pupils from Peterborough secondary schools. Despite the best efforts of this government, the mental health of many students is being impacted by school closures. Will my right honourable friend join me in congratulating local students for raising these issues with me? And while I've heard what my right honourable friend has said about following scientific advice, will he, when considering the right time to reopen schools, put the mental health impact on students at the very top of his priority list?
Yes, and my right honourable friend is right to raise the issues that he does. And we do put mental health concerns at the forefront of all our decision-making when it comes to schools and when it comes to the reopening of schools. And I pay tribute to those students who have taken this issue as seriously as they have done, and which is why we have, over the longer term, putting in place the recommendations in our green paper on children and young people's mental health, which will, I believe, once it's fully rolled out, transform the provision of mental health services for children in our schools.
Video link, Ian Mearns.
Very grateful, Mr. Deputy Speaker. Thank you very much indeed. Mr. Deputy Speaker, the Minister is insistent that there is a clear plan for reopening schools. And of course, we know that schools are largely open for those important children with additional needs or who are children of key workers. But surely we've got to be doing more than hoping for the best. We've actually got to be planning for the worst and letting school leaders and their governors know what these proposals consist of. If they don't know, they can't plan and prepare for the eventuality of being told what the plan is by the Minister. And Minister, can we also please have delivery of laptops which are free of malware? All too many of the laptops delivered to schools in my vicinity, and not all of them have got them yet, by the way, but all too many have had laptops delivered to them with malware.
Well, of course, we do want to give schools the appropriate notice, and that's why my right honourable friend, the Secretary of State, said last week that we would give schools and colleges and universities 2 weeks' notice. And it isn't just for the schools, of course, it's for parents as well who need to know precisely what the childcare arrangements are going to be for their children. As for the malware issue, this occurred in a very small number of devices. They have been dealt with. The virus has been removed.
Video link. Bob Blackman.
Thank you, Mr. Deputy Speaker. I know my honourable friend is as keen as everyone is to get schools back fully open with children back in school. But as we emerge from the national lockdown, it's likely that we'll go back into some form of tiered approach. So can he update the House on what the plan will be? Will all schools of a particular type be fully open, or will it be based on the tier in which a particular area is based? Because that's going to be vitally important in terms of heads and senior staff planning for how they reopen their schools fully.
Well, my honourable friend is right to raise these issues, as he always does. But we continually talk, Mr. Deputy Speaker, to stakeholders, to advisory groups, and we discuss all options about how we open schools when the scientific advice says that it is safe to do so.
Video link. Eric Twigg.
Thank you, Mr. Speaker. I'd just like to put on record my thanks to teachers and the support staff in schools for the tremendous job they're doing at the moment. Well, my question to the Minister is this. Some teachers who have COVID-19 are not just absent for a few days, but actually in some cases for many weeks. Will he ensure that when schools reopen, resource will be available to cover long-term staff absence, ensuring that children do not fall further behind?
Well, the honourable member is right to pay tribute to the teachers and staff in our schools. Sunday, Mr. Deputy Speaker, was International Education Day, and we should be paying tribute to staff in our schools, but also in our FE colleges, in our universities, and in early years settings as well, and to pay tribute to parents during this time, and to pay tribute to the resilience of children and staff as well. Of course, we monitor staff absence rates in our schools, and there are regional teams of support for schools, the Regional Schools Commissioners offices, who will offer help and support to schools that are suffering excessive or high rates of staff absence due to COVID.
Video link. Simon Jupp.
Thank you, Mr. Deputy Speaker. Getting our children safely back into school is clearly a priority for this government, and it's right that reopening next month remains under review. I'm sure many parents in East Devon will be concerned by significant delays, as we all know that although schools across Devon are going above and beyond to provide virtual learning, nothing beats the classroom. Could my right honourable friend confirm the government will keep all options on the table for reopening schools, including reopening on a regional basis, if the scientific evidence supports a phased return based on vaccinations and case rates in different parts of the country?
Well, my honourable friend is absolutely right that the government does want to see schools open. We believe that face-to-face education, being in the classroom, being with their teacher, is best for the education of young people and for their mental well-being as well. So we do want to see schools open as soon as possible, as we've always said during this pandemic, that schools will be the last to close and the first to open. We do consult with stakeholders and advisory groups about the options for reopening, and we keep all those issues under review.
Video link. Mohammed Yazin.
Thank you very much, Mr. Deputy Speaker. There are children in Bedford and Kempston who still can't access remote learning today because they don't have a digital device or broadband. So will his government urgently tackle this inequality and put forward a long-term IT strategy for schools so every child can learn from home and catch up after a year of disruption to their education?
Yes, I agree with the honourable member. We have already purchased 1.3 million computers. They've been built to order and imported and distributed. We've distributed 876,000 of those devices. But it isn't just, of course, about devices. It's also about data. We have partnered with the UK's major mobile phone operators to provide free data for disadvantaged children to get online, as well as 4G wireless routers. And I'd like to pay tribute, if I may, Mr. Deputy Speaker, to 3, to EE, to Tesco Mobile, to Smarty, to Sky Mobile, to Virgin Mobile, to O2, to Vodafone, to BT Mobile, and Leica Mobile for working with us on this service.
Video link. Andrew Morrison.
Thank you, Mr. Deputy Speaker. Does my right honourable friend agree with me that the public health risk of allowing schools, particularly COVID-secure primary schools, to reopen is modest, particularly when set against the 3/4 of COVID symptomatic people who are currently not self-isolating, with all the risk that that brings to public health?
Well, my friend, of course, my honourable friend raises an important point, and he will know, given his own background, that what matters is all of us obeying the rules that are set out very clearly and how to, as a nation, we can manage the reduction in the transmission of this very deadly virus, and is beholden on all of us to obey those rules. And the more we do that, the quicker we can reduce infection in our society, and the quicker we can move out of the lockdown position.
Video link. Kerry McCarthy.
Thank you, Mr. Speaker. I want to echo the concerns of colleagues from Harlow and Hull North about the warnings given by paediatricians and the Children's Commissioner today about children's mental health. I particularly want to ask, children who haven't yet been assessed for EHCPs, so are now at home, what progress is being made in trying to ensure that they do get the assessments even though they're not in school? Because we know that any delay in getting them assessments could have a serious impact on their educational and social development.
Well, the honourable member raises an important point, and this is something that my honourable friend is monitoring very closely with our expert advisors.
Mark Harper.
Thank you, Mr. Deputy Speaker. Before I just ask my question, can I just take the Minister back to something he said in his statement, when I think he said that schools were closed to stop community transmission. In her evidence last week, Dr. Jenny Harris, the Deputy Chief Medical Officer, said it was the other way round, actually. There was no evidence that schools drove large-scale community transmission. It was that community transmission led to infections in schools. But I wanted to press him on was what he said about the criteria for reopening schools. He mentioned a number of indicators, hospitalisation rates and so forth. Can I ask him to set out at what level do those indicators have to get to trigger the reopening of schools? These are decisions not for scientists, they're decisions for ministers, and we want to know at what point that those measures have got to will ministers take the decision to reopen schools to all children?
Well, the point I was making about the reason why schools were been asked to restrict access to children other than vulnerable children and the children of critical workers is nothing to do with the safety of the schools themselves. It is about reducing community activity, and that in turn will then help to reduce transmission risk in those communities. That's the reason behind adding school closures to the other closures in the economy that have taken place prior to that decision that we were advised to take in January. Now, my honourable friend rightly asks about what are the criteria that will determine whether and how soon we move out of the national lockdown position. And as he reminds me, I mentioned those in the opening comments about hospitalisation rates, mortality, the rate of vaccination, and the challenge of new variants. And we do rely, Mr. Deputy Speaker, on the advice of SAGE and the Joint Biosecurity Centre and Public Health England and the CMO and the Deputy CMO, Jenny Harris, as well, when those criteria are assessed and whether they believe it is right to start to undo some of the national restrictions that we're now facing.
Lydia Link. Kate Osmore.
Thank you, Mr. Deputy Speaker. In Edmonton, almost 7,000 children live in poverty. Families living in multi-generational, crowded homes, experiencing food and job insecurity, are really struggling. What is the Minister doing to ensure that all vulnerable children are able to access the support and services they need during this lockdown?
Well, the Honourable Member does raise a hugely important issue. It's been at the forefront of our decision-making right from the very beginning of this pandemic. When we closed schools for the first time, but we did allow vulnerable children to attend school and the children of critical workers, but the attendance rates were quite low, certainly low compared to the rates of attendance from those children today. And we took action to ensure that local authorities made contact with the families of those children and schools as well to find out why they weren't attending school, whether there were good reasons for that, and to encourage the most vulnerable children to attend school. And that remains our position now.
Lydia Link. Hugh Merriman.
Thank you, Mr. Deputy Speaker. And I want to thank all the teachers that continue to work so hard to teach our young pupils. But given by mid-February, we should have vaccinated those accounting for 90% of mortality risk, why can't pupils return to their classrooms later that month? Surely by that time, the risks from school attendance will be lower than last autumn when the school gates were open to all.
Well, my honourable friend is right to raise these issues, and I agree with him to the extent that vaccination is an important criteria that will determine how and when we emerge from the national lockdown position, of which schools are an important part. But it's only one of the criteria. Hospitalisation rates are also important, mortality rates are also important, and so is the challenge of any new variants. And we rely on the advice of the scientists to weigh up those different criteria and to advise us on when and how soon we can undo the national lockdown.
Lydia Link. Kim Johnson.
Thank you, Mr. Deputy Speaker, and I'd like to send my thanks and solidarity to all the teachers and support staff in my constituency of Liverpool Riverside who are working through these very challenging times. Mr. Speaker, the pandemic and school closures has had a widening education attainment gap for working class black and white pupils. The catch-up funding is not sufficient to achieve the levelling up required. Will the government review progress made with the financial support allocated to schools and provide more funding when necessary? Thank you, Mr. Deputy Speaker.
Well, the honourable member is right. I mean, everything this government has been seeking to do since 2010 has been about closing that attainment gap between children from disadvantaged backgrounds and their peers. And we don't intend to let this pandemic divert us from that overarching objective. But there's no question that the pandemic itself, during this period, has widened that attainment gap right now. And our objective is to close that attainment gap again as soon as we can. That's why we secured £1 billion of funding, catch-up funding, of which £650 million is a catch-up premium for all pupils, and £350 million of that is funding the National Tutoring Programme, designed to help the most disadvantaged young people with one-to-one and small group tuition, which is an effective way of helping children to catch up.
Lydia Link. Steve Baker.
Mr. Speaker, I refer to the declarations I've made relating to the COVID recovery group. Would my right honourable friend please either open the schools or justify the decision to keep them closed by quantifying the harms and the benefits of his policy?
Well, as I've said, my honourable friend, of course, you know, I'm always happy to debate these issues with him. And the national lockdown was based on very clear criteria, and emerging from the national lockdown will also be based on very clear criteria. And the schools element of that national lockdown is very much part of that process. So we continually talk to stakeholders, we continually talk to advisory groups, but we will ultimately be led in our decision making by the advice of SAGE, the Joint Biosecurity Centre, CMO, and the Department of Health.
Video link. Debbie Abrahams.
Thank you, Mr. Deputy Speaker. We all want schools and other educational settings to reopen as soon as it is safe to do so. It is absolutely right for the Shadow Education Secretary to be calling on the government to publish their plan defining the conditions for this safe reopening, given once again the confusing mixed messages from this government. The Minister has said that NHS pressures and the level of COVID circulating in the community are key criteria for determining lockdowns, including of schools. So what discussion has the Education Secretary had with the Transport Secretary about the DVLA outbreak and the impact that workplace transmissions is having on COVID case levels? Thank you, sir.
Well, these are criteria that, of course, are monitored the whole time. Wherever there are outbreaks, in whatever segment of society or the economy that those increasing or decreasing transmissions take place, that is the criteria upon which SAGE, the Joint Biosecurity Centre, and CMO and Public Health England will advise us about when it's safe to reopen schools.
Michael Fabricant.
Thank you, Mr. Deputy Speaker. Well, contrary to the mood of this urgent question so far, can I just point out that today is a day where we have surpassed 100,000 people on deaths in the United Kingdom. 37,000 people are currently in hospital for COVID. And now's not the time to set arbitrary deadlines for the opening of schools or arbitrary targets, which means that schools can then be opened. We must go by the medical advice. And in connection with that, may I ask the Minister, does he not think it's a good idea if we were to vaccinate everyone who is an adult who works in school sooner rather than later to stop public transmission of COVID?
Well, my honourable friend is quite right to point to that very tragic milestone, and our thoughts, and I'm sure the thoughts of everyone in this House, are with the families and friends of people that we have lost during this COVID pandemic. And he is right, therefore, to point out that there are 37,000 people in our hospital at the moment with this virus, which is higher than it was at the peak of the virus last year. And that's why we have to take these decisions about the national lockdown very seriously, and we have to rely on the advice of SAGE and the Joint Biosecurity Centre and Public Health England, and we have to look at the pressure on the NHS when reaching those decisions. Now, he's also right to point to the issue of vaccines. The priority initially is on mortality, which means that they focus on age, where the rates of mortality are higher. But once we're through that phase one, then we will be looking at occupations, and the Department for Education will certainly be making the case to the Department of Health for staff in the education sector.
Meg Hillier.
Thank you, Mr. Deputy Speaker. Mr. Deputy Speaker, I was one of those advocating for schools to stay open as long as possible, but I do agree with the Minister that with the height of the pandemic that we're in now, it was the right thing to do. I say that very reluctantly. However, the longer it goes on, the worse it is, as we all know, for pupils. There's a lot of fanfare about the national tutoring programme, but what serious consideration is he and the department giving to providing proper catch-up summer lessons and so on, particularly for those young people going into exam years, because these young people won't get that time back, however good the online learning is?
Yes, the Honourable Lady is absolutely right, and this is an issue that we are considering the whole time, and the £1 billion catch-up fund is important, so is the national tutoring programme. But of course, we have to also take into account what we're going to do when children are back for the longer term to make sure that we do help these young people to catch up. And the older they are as school children, the less time they have left in school before they leave. So this is an issue we are giving a great deal of thought to as we plan further announcements in the near future.
Video link.
Thank you, Mr. Deputy Speaker. Does my honourable friend agree with me that Scotland would be better served if the SNP bothered to care about more than their fixation on yet another independence referendum, and rather than callously exploiting the crisis, began prioritising the education of Scotland's children, who the SNP shamefully continue to let down by years of failing education policy due to the SNP's poverty of positive ideas and responsible leadership?
Well, my honourable friend is preaching to the choir when it comes to advocating prioritising education policy above all other policies in government. I think as a schools minister, I would say little else.
Not sure whether the minister was the right person to ask that question of, but nonetheless. We'll pass on. Video link, Ellie Reeves.
Thank you, Mr. Deputy Speaker. Special schools in my constituency, Brent Knoll, Riverside and Watergate, remain open and are doing a tremendous job, often providing personal and medical care on top of teaching. I echo calls that the school staff be a priority for vaccinations. But will the Minister also consider treating staff in special schools akin to frontline care workers and be prioritised for the vaccine without delay?
Yes, that is an important point to raise. And as I've said before, the JVCI's priority is mortality, which is based principally on age, and also they prioritise those working for the National Health Service and in care homes. But the second phase will be occupationally based as well, and we will be making the case for staff in special schools, as well as other staff in the education sector.
Video link, Mary Robinson.
Thank you, Mr. Deputy Speaker. Will the Minister join me in thanking teachers across Cheadle who have educated vulnerable children and children of critical workers in school, as well as managing the challenges of remote learning? When schools fully reopen and the Minister assesses the inevitable variation in children's learning throughout COVID, will he also recognise the educational impact of regional COVID restrictions, which cause pupils to lose even more time in the classroom due to our local higher case rates in the autumn? And would he consider additional targeted educational resources and teaching support to address any educational disadvantage as we move beyond COVID?
Well, I certainly do join my honourable friend in paying tribute to teachers in Cheadle, combining both teaching vulnerable children and critical workers' children full-time in school, as well as providing high-quality remote education to those pupils who are at home, is a huge challenge. And of course, teachers also have to maintain all the safety measures that are in place in schools to ensure that we minimise the risk of transmission in school. So we're all aware, I'm aware, of the very real challenges that teachers face. And of course, catch up, making sure that those children who have not coped as well with remote education as they would in the class are able to catch up as swiftly as possible once they return to school is a key priority for the department, and we'll be saying more about that in the weeks ahead.
McDonagh.
Thank you, Mr. Deputy Speaker. Of course, schools need a return plan, but what about those children unable to learn remotely in the meantime? The government slowly distributes laptops that are unusable without connectivity, but 1 million children have only mum's mobile as their connection. A further 500,000 have no connection at all, so cannot receive network data boosts. 9 months on, why has the Minister still not ensured these children can connect from home so they don't fall even further behind?
If I'm allowed to, Mr. Deputy Speaker, I'd like to pay tribute to the honourable member for her assiduous work on the issue of remote education. We have purchased 1.3 million computers for children and young people in our schools and colleges at a time when there's a huge global demand for these devices. They've been built to order, imported and shipped and distributed. 876,000 of them are in the hands of schools and pupils now. But she's also right to point to the issue of data, and we have partnered with the UK's major mobile phone operators to provide free data for disadvantaged children so that they can get online using, for example, their parent's smartphone, and they won't have to pay the data charges for downloading educational material.
Video link. I think we can see you. Could you ask a question? Thank you.
Thank you, Mr. Deputy Speaker. Apologies, the audio went there. Will the Minister join me in thanking all of the hard work done by the teams at our schools in Great Grimsby? And as Grimsby now has one of the lowest infection rates in the country and has reducing hospitalisations, will he consider allowing at least infants and primary schools to return in the town after the half-term break?
Delighted to join my honourable friend in paying tribute to teachers in Great Grimsby for the work that they are doing in keeping schools open for those vulnerable children and critical workers, as well as all the other work that they do in continuing to teach children while they remain at home. Look, you know, we take the advice of SAGE and the Public Health England and the CMO in terms of how and when we can remove the restrictions on access to our schools. It will be part of the national lockdown decisions, and we will take their advice when we make those decisions.
We've heard you perfectly there, Leah. Thank you very much. Rupa Huq.
Thank you, Deputy Speaker. Can the Minister tell me, did the PM's much trumpeted army of catch-up tutors from the first lockdown ever happen, or was it just Ealing that got left out? And how will he fund, after a second year of disruption, not just the academic deficit, but the emotional damage done, not just to pupils, but to teachers? We expect them to be superhuman with their own bereavements, bursting bubbles, kids, long COVID, and yet they've had no recognition in pay or vaccines, and CAMS had a 2-year waiting list even before coronavirus.
Minister.
Well, the National Tutoring Programme is a big programme. It is overseen by the Education Endowment Foundation. There are 33 tutoring companies, 15,000 tutors are signed up, and we intend to reach 250,000 of the most disadvantaged pupils. This is a very effective evidence-based approach to helping catch up. If there are particular circumstances the Honourable Member wants to bring to my attention, I'd be delighted to have those details, and I will take it up with the Education Endowment Foundation.